Welcome to Perfect Guardian, and I'll tell you about uncontrollable shaking. Tremor or uncontrollable shaking is an involuntary muscle contraction and relaxation having to and fro movements of one or more body parts. Hands, arms, eyes, face, head, vocal folds, trunk and legs. Some people have tremors because of some underlying neurological disorder, while others have also felt them at some point of time caused by fear or excitement. A common type of tremor is chattering of teeth, which is caused by fear or induced by cold temperatures. This, however, stops after a few minutes. But uncontrollable shaking is a common symptom of disorders that destroys nerve tissues such as Parkinson's disease or multiple sclerosis. Uncontrollable shaking may also occur as a result of a stroke or head injury. Tremors are also triggered by excessive stress or strong emotions. When a person is physically exhausted or during certain posture or movements caused by improper functioning of a cerebellum, the part of the brain that controls muscle movements. Therefore, it becomes all the more necessary to understand the type and causes of this shaking, which is uncontrollable, to be sure of what you are dealing with. Now, cerebellar tremors or intention tremors. This type of tremor may occur in any external part of the body. It may happen because of some stroke which may damage the cerebellum or due to excessive alcohol or withdrawal of it and overuse of some drugs. It occurs slowly but for a broader period. Now, dystonic tremors. People who are suffering from dystonia are most likely to have this tremor. They can happen of a person of any age and can be relieved by combination of rest and some medications. Essential tremors. The most common of all tremors, essential tremors, are progressive in some and non-progressive in others. Hands are the most affected part in these tremors, whereas other parts that may be affected include head, trunks, legs, voice and tongue. Now, orthostatic tremors. This type of tremors strike a person immediately after standing and affect the legs and the trunk. And as there are no signs of symptoms present for such tremors, they are difficult to detect and treat. Now, Parkinsonian tremors. Parkinsonian tremors are caused due to damage in the brain and mostly affect people suffering from Parkinson's disease. They start from one part of the body and spread to another part of the body and usually strike after the age of 60. Now, psychological tremors. Though not visible by eye, psychological tremors are experienced by everyone. They are heightened by strong emotions, physical exhaustions, hypoglycemia, hyperthyroidism, stimulants, alcohol withdrawal or fever. Now, psychogenic tremors. Psychogenic tremors can affect any part of the body. Usually they are sudden and involve a combination of postural, action and resting tremors. They decrease with distraction and are a result of number of psychosomatic factors. Now, cause of uncontrollable shaking. Too much coffee or other caffeinated drinks, stroke, stress, lack of sleep, particular vitamin deficiency and anxiety, neurological disorders or conditions like multiple sclerosis, stroke, traumatic brain injury, chronic kidney disease, overactive thyroid is known to cause postural tremor, low blood sugar, brain tumor, various drugs and prescription medicines, excessive alcohol consumption or alcohol withdrawal can kill certain nerve cells leading to the condition. Body muscles traumatized by injury, disease or as a result of systematic illness. Withdrawal of tobacco may also induce the problem. Now, diagnosis of uncontrollable shaking. The cause of uncontrollable shaking can be determined by CT scan, MRI scan, blood tests or a bunch of other tests. Now, these are the facts that I told you. about uncontrollable shaking. In the next video, I'll tell you about the treatment of uncontrollable shaking. So thank you. Please subscribe to my channel Perfect Guardian and give your comments.